Welcome to episode 19 of Traveling Science. G'day legends, welcome back to Traveling Science, the podcast that's sharing science with the world. My name's Crowe and I'm the Traveling Scientist, coming to you today from my home in Aireys Inlet in Australia. I'm a health science communicator, and on this podcast, I interview doctors, researchers, and experts, hearing their stories and sharing their ideas that can help us to live smarter, happier, and healthier lives. This week's guest is Manny Nsien, the CEO of Ripple Ranch Recovery Center in Texas. And back in the day, Manny worked as an operations consultant in emergency rooms all around USA, focusing on improving the quality of healthcare to enhance patients' experiences and outcomes. But then he moved into the behavioral health space, trying to help people with issues surrounding mental health and addiction. And Manny's passion and his goals are to reduce the stigma around mental health problems and substance abuse, and to empower people with knowledge so that we're all better equipped to deal with these chronic issues that affect so many people around the world. And during our discussion today, Manny answers questions including: what are the causes of addiction? How can we treat addiction in a clinical setting? What are some of the most common addictions? Which addictions are most dangerous to your health? Why addiction is a chronic illness? And what to do if you're struggling with addiction. And we also discuss things like caffeine addiction, travel addiction, taco addictions, workaholics, eye movement desensitization and reprocessing therapy, childhood trauma, SAMHSA, coping mechanisms, and rehabilitation. So if you or somebody that you care about struggles with any sort of addiction, get ready to learn about the possible causes and solutions with the one and only Manny Nsien. Manny Nsien, welcome to Traveling Science.
Hey, how you doing? How you doing, Jesse?
I'm really good. Hey, thank you so much for taking time to come on the show today. We really appreciate it. Just to get started, would you like to tell us, what did you study at university?
Yeah, sure. During my undergrad, I went the route of bioimmunology and infectious diseases. And then I did my graduate education at George Washington University and got a master's in health administration.
And now you are skip ahead a few years, you're the CEO at Ripple Ranch, is that correct?
That's correct. CEO of Ripple Ranch and Continuum Outpatient Centers, which is an inpatient and outpatient provider for mental health and addiction. So we address the acute onset of addiction and mental health crises, as well as providing a continuation of care for those that are stabilized and need continued support when they're back in the community.
So an inpatient is somebody who stays at Ripple Ranch while receiving treatment, while an outpatient is someone who comes to Ripple Ranch for treatment, then goes home again. And these guys are focused on helping people who are struggling with substance abuse addiction and mental health issues, because sometimes these things can work together and it's real bad. As we've been discussing on the show a lot lately, mental health can be a huge issue, and it can be directly related and lead to things like substance abuse, which is not great. So maybe if you just want to talk a little bit about how is it associated with substance abuse? Like, does one lead to the other, or is it the other way around, or does it go both ways?
Yeah, it goes both ways. I mean, it's a good question, because you do have individuals that may experience with substance, and that could lead to the development or an earlier progression of an underlying mental health disorder. But then there's a very often trend where individuals have a mental health issue and go to utilizing substances to self-medicate, or use that as a very poor coping skill to try to alleviate some of the symptoms that they're experiencing due to their mental health issue.
Right. So if you're sort of struggling with, say, depression or anxiety or something, maybe it's like a form of escapism. It's really easy to use some sort of drug to get out of there and kind of escape that. But I guess that's a problem in itself, because it doesn't really solve any problem, does it?
Right. Not at all. And, and I think that's what we see, in our population and I think in our communities. There's a lot of misunderstanding about, which one came first. Was it the substance or mental health? And understanding the dynamic, and the impacts, you really have to look at the individual, because every individual has a unique experience in how they got to where they're at. But all in all, both substance use and mental health, obviously, it's not good, and it's very challenging to manage for the individual as well as their support system.
What are some of the other causes of addiction? I know that I suppose genetics could play into it to some degree.
There is a lot of evidence to support that there are some genetics related impacts or factors that could lead to a higher likelihood of someone, experiencing a substance use disorder in their lifetime. But I think I would also encourage people to understand that, while we could believe that it's a nature aspect, there is a lot that has to, do with how they're brought up and how their life experience are, and some of the more experiences when they're younger that can lead to an exacerbation of or use of substance use. And most commonly, what we may not talk a lot about are the adverse childhood experiences that really start someone on the worst track, and then that leads to a higher likelihood of someone getting into utilizing substances or experiencing some mental health issues.
Yeah, things like childhood traumas or just trauma in general, I imagine, can really push someone to search for that kind of short-term solution.
Absolutely, yeah.
And I guess in saying that, environment must have a big impact, right? The people around you, your upbringing, I suppose, your environment is going to have a huge influence on whether or not you struggle with things like mental health and addiction. So yes, your genetics can play a role in your tendency to form addictions. Research from the American Journal of Public Health shows that if your relatives are addicted to smoking, you are also more likely to become addicted to smoking. And if your dad was always taking you to the racetrack, even if he said it was because he liked to look at the horses, you might be more inclined to gamble every once in a while. But this is partially genetic and partially environmental. Regardless of your DNA, if you're around smoking and around gambling, you're more likely to get hooked and inevitably lose all your money. So your environment also has a huge impact on whether or not you might struggle with mental health and addiction issues. But, like Manny said, adverse childhood experiences can play a huge role here. We're talking about childhood traumas, and really just trauma in general can push people to look for short-term solutions like substance abuse to try and escape their reality. So if somebody's parents were kind of crummy or just downright awful, this can also lead to a bunch of problems later in life. So now we know what causes addiction, what can we do about it? Yeah, so treatment plans. What exactly do you do at Ripple Ranch? Or how do you help someone who's maybe really having a tough time? Like they've called you up or they've come in and they're really struggling with some substance abuse addiction and they need help. What is like the first step?
Yeah, the first step, like I mentioned, is really looking at every person as an individual and understanding that they have to have an individualized treatment plan that really addresses their experience, their life, and ultimately finds a solution for them. But, as people enter into our program in particular, we do a comprehensive assessment that, has a combination of medical interventions to really look at if they have any other medical comorbidities that are happening, simultaneously with the addiction issue. Then we look at psychotherapeutic, understanding through a biopsychosocial assessment. And then we sometimes have to even get psychiatrists involved and do very, complex psychiatric evaluation to really understand their baseline. But, what we see most commonly is that individuals utilize the substances because of some other underlying issue, which most commonly is mental health issues. So they could be experiencing severe anxiety, severe depression, or struggling with PTSD.
And if you or anyone you care about might be struggling with these issues, check out our recent episode with Victoria Lynn Carrier, who has so much awesome information around how to talk about mental health and find appropriate treatment. But anyway, Manny was talking about diagnosing and treating addiction.
And so at our program, we really look at using, all of these advanced clinicians and medical providers to really provide an appropriate diagnosis and then develop a comprehensive treatment plan that will allow them to identify coping skills and mechanisms to really address why they may be going back and seeking substance use to address their needs.
Incredible. So I imagine those treatment plans would involve a lot of therapy, like cognitive behavioral therapy. So sort of talking about the issue and, like you said, finding different ways of different thought patterns to help people navigate around whatever it is that might be bringing them back to the same problem, that same substance abuse every time.
Right. Like you said, cognitive behavioral therapy, dialectical behavioral therapy, CBT, and trauma-focused, therapeutic interventions, yes, are utilized. And we've also, found that for, our program, addressing the trauma by utilizing EMDR.
Okay, so naturally, I had to ask Manny, what is EMDR?
It's eye movement desensitization and reprocessing therapy. So it's a handful.
Okay, so naturally, I had to ask Manny again, what is EMDR?
It's a way of really trying to pinpoint when someone experiences the disturbance that may keep them in this negative core belief and cycle that leads them to relapse over and over again. We've been able to, really just pinpoint and focus on that and try to alleviate some of that stress that may have happened back when they were just a little kid. And sometimes if that's untreated and we're not really addressing that issue and we're only focused on the substance, then we're going to see someone, stop using the substances, but still have that really challenging, dark belief that really leads them back to the same point of using drugs.
Wow. And that involves going back to like a specific moment in time, maybe one that's like burned into someone's brain that's causing some sort of trauma that's making them feel awful and just search for an escape.
Mm-hmm. Yeah, because what we found is like sometimes when people have a traumatic experience, that trauma prevents them to really create new experiences, even positive ones for that matter. So they get stuck in this cycle and this hardcore belief that whatever that trauma is, that's really defining their experience in life. So, it really does require the appropriate trained clinical interventions and support from the medical team, of course, to really, develop a program and a plan that can help them, overcome that issue.
Is it ever a situation where you need to use drugs to help patients with their drug addictions? Like, is that something that happens?
Yeah, and at our program we do. So when people are in the detox level of care, which is the most acute, they're depending on the drug of choice that they have. So if they're experiencing drug issues with benzodiazepines, alcohol, or opiates, you have to use medication to really alleviate some of the post-acute withdrawal symptoms that people will be going through, which are rather severe and can prevent someone from actually going through the process of getting help. And also it could be deadly to them if they aren't able to have the support. So yeah, you have to use medication oftentimes to help them at that acute stage, but also even further. So sometimes people remain on medications to really minimize the cravings and support them and allow them to develop the coping skills that they need.
Yeah, wow. I can imagine that for certain substances would leave patients with such withdrawal symptoms, it might be too severe for them to even cope with normal life. So sometimes certain medications might be needed to help wean them off whatever it is that they're using to try and get back to some normalcy.
Mm-hmm. Absolutely.
What are some of the biggest challenges that people can face when going through these issues with mental health and addiction? And
yeah, so I mean, there's clear barriers to success, and most commonly it comes down to three areas. One is making sure that their community is supportive of them seeking and obtaining the sobriety that they're looking for. And making sure that environment is conducive to them healing. The second thing is related to income and opportunity, making sure that they're able to, get back on the right track and have the financial stability to really build back their life. And then the third factor is really looking at stable housing, having someone be able to go from an inpatient environment. And if they're going to go back to their environment or their neighborhood that was really negative, you have a high likelihood that there could be an increased chance of recidivism.
Word of the day, recidivism is the act of a person repeating an undesirable activity after that behavior has been dealt with. So the chances of recidivism, that is, the chances of somebody who has received treatment for their addiction to fall back into that addiction, those chances are high if they go back to that same lifestyle that led them to substance abuse in the first place. Recidivism. Good word. Going back to that first one, you talked about support. What's the best way to get people the kind of support they need? Like, is that talking about a sort of group therapy setting, or is it more about talking with the friends and family, or?
The group therapy aspect of it is helpful. The continuation of care for when they have an acute onset of an illness to managing the maintenance of that chronic illness is absolutely important. But moreover, it's really important to have a solid support system. So that's their families, their friends, being in church or going to AA or NA or other support groups that really allow them to work through their issues individually, but also understand that there's other people that are experiencing similar, complexities in life. And so we found that the more success is found when individuals have solid transition planning, solid support systems, and they're actually engaging in those, support systems as well. But we just see everyone do a lot better if that's what they, end up doing once they leave, the inpatient environment.
Yeah, I think that's really important. That supportive environment is just so crucial to help people get through it, together, not alone. Because I think feelings of loneliness can drag someone right down back to feeling awful and doing something that they might later regret. Let's talk a bit about maybe like the stigma around this whole mental health and substance abuse issue. Like, I feel like there are some common misconceptions. People just like to look the other way and completely ignore it and not even think about it. So can we talk a little bit about maybe a different way of approaching the whole subject?
I think it's really important for us to appreciate and look at substance use disorder as a chronic illness. And I think when we look at that instead of just this acute onset of an issue caused by someone's decision or choice, it changes the way that we deal with it. Because when we look at other acute or chronic illnesses like diabetes or asthma, we don't hold the same stigma as we do with mental health or addiction. And so we have to look at the fact that most individuals will require a lot of wraparound services downstream to really ensure that they're going to have longevity in managing the chronic illness, just like there's a similarity between someone that has diabetes type 2. They would have to stay on a strict routine of diet, medication support, education support. They would have to change their entire lifestyle, which takes a lot of time. And there's no difference with addiction and mental health illnesses. This is something that won't change overnight, and it will require the support of their community. It will require lifestyle changes, and we need to, look at it as such, as a chronic illness that will take some time to manage and ultimately overcome. But it is possible. But I think if we were able to shift our view of how we look at the symptoms and the prognosis of substance use disorder and mental health illness, I think we would actually see better outcomes, because I believe we would really look at providing those downstream services that are so critical for others, for people to see long-term success.
Yeah, I think we really do need to look at it in that different light, because it's not a choice. You didn't choose to have asthma, you didn't choose to have psoriasis, for example. People don't necessarily choose to end up in these difficult places where they end up. Like we've talked about, it's a combination of genetics and environmental factors, your upbringing, and maybe what has happened to you during your upbringing, which can sort of force you onto this path. And it's not necessarily a choice, and you should have the opportunity to be treated like any other patient that's suffering a medical illness. Yeah, I think that's a really good way to look at it. So thank you for sharing that. I wonder if you have any advice for someone who might be listening and might have a little bit of an addiction, or might think maybe they should talk to someone, or some advice for someone who has a friend or a family member who might be struggling with addiction and might need some help. Is there any advice to help people get started in the right direction?
Yeah, I mean, there's a lot of resources, and depending where you live, I think it's important to explore those resources first and understand that there are people out there that will help and support you through navigating, the complexities of what may be going on with you or a loved one. And then, the second thing is, I think identifying what are the things in our lives that are causing reoccurring stressors, and really looking at ways to develop positive coping skills to really manage through them is also healthy. For me, for instance, I work a lot, and I have a lot of stressors that are associated with that, and I have a family and a kiddo, and I have to not only be there for my team, but I also have to be there for my family. And what's really helped me, and what I do now, and these are little things that you can do, is I do a lot of mindfulness, a lot of meditation, yoga, and these are things that allow me to process through some challenges that I may be going through. And that's not to say that you can just do those things and address addiction or address your mental health illness, but it's the little lifestyle changes that we can make in our diet and our health and our awareness of what's going on with us. And then also not being afraid to say that I need a break, and that you need to take some time back. I think that we've come a long way in every community, that we're a little bit more accepting of when people just need to take a break and take a step back. And I think it's important for you to identify it for yourself, but also if you look at a loved one or someone that seems to be struggling, don't be afraid to bring it up. Don't be afraid to, let them know that you're there, you support them, and you care about them. And I know that sounds very simple, but sometimes that makes a huge difference and can allow someone to be open and vulnerable and honest about maybe some things that they're experiencing that are troublesome.
Absolutely. And you say it sounds simple, but sometimes it's not, because even having those conversations with people that you care about can be maybe a bit uncomfortable, maybe awkward. Maybe it's easier to just say, oh, they're fine. They're fine. But just to say, hey, let's take a moment, let's sit down, let's have a chat, and maybe just being there for someone and being supportive and starting that discussion can really help. And that's for friends and family members. I know I already mentioned the recent episode on mental health, but this ties in so well. If this interests you and you want to learn more about how to have those difficult conversations with the people around you, the people who you care about or who care about you, do yourself a favor, listen to the episode of this podcast with Victoria Lynn Carrier. She breaks down exactly how to speak up if you're struggling with mental health, and how to talk to friends and loved ones who might also be in struggle town. But for now, let's talk about self-care. Taking it back to the individual and to the self, like you were saying, self-care is super important. And stress, as you highlighted, stress can be a huge factor for anyone using any sort of substance or dealing with mental health. Just trying to find what lifestyle changes that can maybe reduce the stress a bit. Maybe take that extra day off work. Maybe try to find just a couple of minutes a day to just breathe. Try a mindfulness practice or a meditation practice, which for a lot of people can be uncomfortable because it's like maybe it's a bit too spiritual or woo-woo, but it's scientifically proven. There's a lot of research out there saying that these practices are super effective at helping people lower their heart rate, reduce levels of cortisol, and just reduce stress. And like you said, just those little changes can really add up and have a huge impact on your overall well-being. So if you want to learn more about mindfulness and meditation, listen to episode 8 of Traveling Science, all about improving focus and treating anxiety with Dr. Anna Panida. And if you want to learn more about changing your lifestyle to reduce cortisol and stress levels, listen to episode 10 of Traveling Science, which is all about mastering your cortisol to boost energy and reduce stress. I love those suggestions. Do you have any other, just while we're on that topic, any other advice or tips for people who might be going through some sort of addiction?
I would say that oftentimes we see people seeking treatment or care to address their illnesses a little bit too late, when it's a crisis, when it's extremely emergent. But similar to the things we were, discussing, if you feel like you need to talk to someone, you need a little bit of talk therapy, we need to also normalize just seeing a therapist and going to get help and going to seek support before we have a crisis event. And I think what we can do is with our friends, with our loved ones, really just normalize the fact that seeing a therapist, going to get help, asking for help is okay. And, because I think by the time someone gets into these crisis events, it becomes extremely expensive for the individual. It becomes extremely more challenging for the family and support system because they may not have known that something was brewing. And so they just see someone go from smiling to needing to be in an inpatient environment. And so I think there is, if we can educate individuals about getting help sooner at maybe an outpatient setting or at individual counseling, that will hopefully minimize the likelihood of someone having this acute, episode that will require a lot more expense as well as more, stress for the individual.
Yeah, I think that's a really good idea. Again, opening the discussion, opening the conversation, and yet seeing a therapist is a great idea. I actually have a YouTube video called, what is it called? Something like Everybody Needs CBT. And just the idea that no matter who you are or what your story is, what your past is like, I think everybody to some extent could benefit from sitting down maybe once a week with someone who's sort of outside of their life and just talking and just sharing. And sometimes they'll get some valuable information back. Sometimes it's just a matter of being heard. And even that is enough to make you feel great. So yeah, I think it should be more normal, and maybe more people should be seeking someone professional to just have a chat with every once in a while.
Absolutely.
Fun fact, I recently started speaking with a therapist. Why, you ask? Well, that's none of your business. But I can confirm that it's been extremely helpful. It has brought more understanding, clarity, and happiness into my life. And I look forward to my weekly sessions. And I always leave each session with a newfound passion and excitement for life. So yeah, this is me talking about therapy like it's a normal thing, because that's how we should all see it. It's not something that you should be embarrassed about or ashamed of. I've got a few more questions about mental health and addiction, but I just want to talk about you for a second, Manny. How did you get into this job exactly?
Yeah, I mean, it's a fun story. So originally, I had aspirations to become a doctor, and I really loved medicine, and I wanted to be a family medicine provider and just look at communities and figure out how we can improve population health. That's something that I grew up just really loving. But it really dawned on me that my father was a doctor, and it's a really tough lifestyle. I mean, you have to certainly be committed to that. And, for the people that are in healthcare professions, it is not as glorified as it seems. It's a commitment that they have to really work hard at.
Yeah, it's a lot of stress, I imagine.
A lot of stress, yeah. And so, I ended up pivoting to the administrative side, and I fell in love with it the moment that I started getting into that realm. And so the reason why I chose the behavioral health route was because there's, like we're talking about today, there's not a lot of conversations about behavioral health, mental health until we actually need it. And that, to me, having a family that has some mental health illnesses, I really looked at, how do we normalize this conversation? How do we make this something that we're talking about at the dinner table, that we're talking about normally? And so I was really fascinated with, looking at systems that we could create and ways that we could educate our community more on mental health, on substance use, and making it something that we talk about openly, and we're not providing this negative stigma or anything like that towards it. So, I had the opportunity to, work with, for-profit companies at first that were focused on substance use and mental health, and then, worked my way to a nonprofit, which is where I'm at today, which still focuses on mental health and substance use, but it's more specific to our community here in Texas.
I love that. And so just to clarify, non-for-profit, that means that, what does that mean exactly?
Yeah, so I mean, really what we focus on is the charity care, being able to allow people to get access to care that otherwise could not do that. So while you can utilize insurance, there's many different factors that may be plaguing individuals that are experiencing mental health or substance use issues. Some may be unemployed, some may be going through a transitional period. And so what we wanted to do is really establish a way that, if somebody had a challenge, that we could allow them to still get access to care. And our goal is to really look at ways that we can grow, that, and look at the specific communities in which we're in and find a way to, improve the access to care, the access to inpatient and outpatient support, as well as education within the community in which we serve.
Incredible. So it's not like you're just treating rich people with drug problems, like you're trying to help as many people as possible.
Yeah, I mean, because there unfortunately there's no class that is immune to substance use disorder or mental health, and so it really is any individual that's in our community that might be experiencing it. So we do our best to try to make sure we do what we can. And I think there's a lot of providers that are out there that have the same view, and it's just really supportive to look at the community that we're able to be a part of and just collaborate to find solutions for our neighbors.
Who inspires you, Manny? Is there anyone that inspires you to do the work that you do?
I would say my grandparents inspired me. My grandmother has been a nurse. She was a nurse for years, and she's from Nigeria, and she did a lot of work there to really support education as well as healthcare for individuals there, and then came to America and continued to work as a nurse here. And then my grandfather was an educator, so he was a professor in Nigeria as well as when he moved here to the U.S. And I think the combination of the education and the health part really just resonated with me. And it's something that I try to, incorporate into everything that we do in regards to our programming too, because obviously it's important to address someone's medical needs and make sure that they're taken care of. We also want to empower them with the education to make better decisions so that they don't have crisis events, that they're able to go out into the community and spread the positive word. So I would say my grandparents are extremely impactful for me, and I every day try to live at least in a positive light with their teaching and support and love.
Fantastic. Well, shout out to the Nsien family. It sounds like you've been doing some amazing things for a very long time. I wonder if you have any book or movie recommendations for anyone that would like to learn a little bit more about this topic that we've been talking about today.
I think the book that would come to mind is The Body Keeps the Score.
Subtitle, Brain, Mind and Body in the Healing of Trauma, The Body Keeps the Score is a #1 New York Times bestseller by Dr. Bessel van der Kolk. And I was going to explain what the book was about, but bugger me, Manny already beat me to it.
It basically dives into a lot of the topics that we discussed, where you look at trauma and the root origin of trauma and ways that we can utilize a holistic approach of yoga, meditation, and mindfulness to really address that. So it's a fascinating book that oftentimes a lot of people on our team will read it or bring it in and learn a lot of the concepts that we actually are able to see positively, impact, the individuals' lives that we take care of daily.
And I just wonder if there's any daily rituals that you live by yourself, something you sort of have to do every day.
For me, it's really important to have a moment of meditation and mindfulness. I do that every single morning that I wake up. And my primary focus is to look at the previous day and potentially all the things that went well and all the things that went horribly wrong. And just focus on the fact that, I'm blessed with another day and I have an opportunity to make it better. And I think, we oftentimes get stuck living in the past. And that's a process for me to really identify the things that I need personal growth on and things that I can, improve my life on. And that's professionally, that's personally, all around. But it's really allowed me to become very grounded and also work through some of the challenges, because then I say, well, if this was the worst thing that happened yesterday, I'm still here, I have an opportunity to make it better. And let's try to just make life, at least 1% better every day. I think that's a very obtainable thing. And that's what I try to do.
Just taking a moment for self-reflection and a bit of mindfulness and meditation in the morning is a great way to make the most of every day. And I know a lot of people might not have time for that if you're too busy, but you can always make time, just a couple minutes.
Yeah, for me, it's really only 5 to 10 minutes max. And it's just really that personal time to just look at how can we put the best foot forward today and make a difference.
I love that. Manny, I've got a few listener questions here from our followers on Instagram, if you've got a moment to answer some of those. But before that, each week here on Traveling Science, we make a donation to a charity of the guest's choosing. And this week, Manny has chosen to make a donation to the Foundation for Ripple Ranch, which is a non-profit organization dedicated to providing access to effective mental health and addiction support and treatment for anybody who might need it. So a donation has been made to the Ripple Ranch Foundation on behalf of Manny Nsien. And if you'd like to make a donation to them as well, you certainly can. And if you'd like to support this podcast and the charities that we donate to every single week, you can certainly do that too, and that'd totally be appreciated. In both cases, those links can be found in the show notes just below. But for now, let's get back to traveling science. But the first question is from Sheztech, who was wondering, what is the most common addiction that you see?
Yeah, so that's a good question. In the US, what has been a primary focus is opiate use disorder, and those that are struggling with that. But what we see more commonly, more frequently, is alcohol use disorder. We have a lot of individuals that are struggling with alcohol. You would think that the way that our market really, glorifies it and puts it everywhere and, and just puts it at the forefront of everything we do, that it wouldn't be, something that maybe is hurting so many people, but it is. And it's interesting because that's also the one drug of choice that can be extremely deadly, similar to benzodiazepines and opiates. And usually people are doing it as a polysubstance abuse issue. So they're not only just using alcohol, they're using opiates, they're using stimulants. And so it can be extremely dangerous, but that's what we see as the most common drug of choice.
Yeah, and it's just bizarre that alcohol is also just so readily available and open and out there and advertised and promoted as a great thing when it can be really bad if you can't sort of manage it. Sheztech also wanted to know if caffeine addiction is an issue. Is it a problem?
Yeah, it is a problem. And let me provide the context to how it's a problem. We are a society that always is working and driving ourselves to be better. But, what we often sometimes forget is that if we have too much caffeine, that we could also be negatively impacting our ability to sleep. And if we aren't sleeping well, we aren't able to have, that necessary time to recharge our brain and our health and our body, it really can add a negative impact and lead to medical issues that could arise. And I think we're so focused on like, oh, I gotta use my caffeine, I gotta do it. But a lot of people take caffeine late in the evening, and it can take up to 4 hours for it to just dilute out of your system. So I think that's, something, if combined with other things, it could be really negative for you, and it could impact your nutrition, your physical health as well.
Yeah, absolutely. So for anyone out there who's drinking too much caffeine, I know, use it as a tool. When you really need a little energy kick, I drink tea every day, but I drink like coffee once every few days. And I use it on the days when I really need just a little bit of extra kick. But if you're drinking like 3 or 4 coffees a day or more, I don't know when it gets to a problem, and I know everyone's a little bit different, but, just maybe take a step back, a little bit less. Reggie Pagey was wondering, can traveling be an addiction?
I mean, if it were related to financial issues, sure. And I think that anything can be an addiction, right? We look at very successful people that work so much, but they're successful. But is there a work addiction? Absolutely. So traveling, you certainly could travel too much if it financially did not align with your ability to pay your bills, right? So I think that we have to look at the behaviors that people are going through, and whatever that may be, whether it's traveling or whether it's eating too much, whether it's taking too much caffeine, and or smoking for that matter. And we can attribute an addiction to that potentially.
Maybe it's a bit late in this episode to be defining what an addiction is, but just to clarify, addiction is a neuropsychological disorder in which you have a persistent and intense urge to do something that makes you feel good, despite any negative consequences. So if you eat nothing but, I don't know, tacos, that's probably not super healthy. Therefore, you're addicted to tacos. Or you could be addicted to video games if you play so much that you forget to feed yourself, or your kids, or your cats. I don't know your situation. And you could be addicted to travel if you spent every last dollar you have on plane tickets. If you do something that feels good and ignore the negative consequences, you may have an addiction. So what can you do about it? Well, let's find out. Invader Tim was wondering how can you get help if maybe you can't afford it? If you're having monetary issues, is there any recommendations on where to go?
Yeah, depending on where you're at. I mean, there obviously you have listeners that are all around the world, but at least for the U.S., I mean, there are local options that you can look for. You can look for your Center for Mental Health. You can look through SAMHSA.
If you're in USA, SAMHSA stands for Substance Abuse and Mental Health Services Administration. Look it up. They have stacks of information and people to contact if you're having any issues with SAM. SAM being SAMH, Substance Abuse and Mental Health. You get it. SAM, SAMHSA, whatever.
And they have a lot of search tools where you could look up based on your zip code where there are some resources, and that's specific to the US. But I think, it's also not a bad idea to always seek help through maybe a primary care provider, because they can also be a resource to provide some case management support to find some, either inexpensive options for you or options that are in network with you, which might be more affordable.
Yeah, that sounds great. And I might just drop one more in, which may or may not be appropriate, but someone I spoke to recently on the podcast mentioned that there are even some local groups that you can find, sort of just people to talk to, like if you need to get into the system. But sometimes, going through a doctor can take some days or weeks to actually see somebody. I think there might even be some sort of groups that you can reach out and they might offer some peer support, someone so you can talk to that day, just to get you started in the right direction. And that can sometimes be a free service for people that really need it.
Yes, absolutely. And I mean, it depends on what it is. I mean, here in the US, for us, we have a phenomenal line called 988, which is for suicide prevention and support. So obviously that's a resource for individuals that are in the US. And I think, we always need to share that information as much as possible. So there is help always if you're in a crisis someone can help you navigate through that.
Absolutely. Thank you so much for answering those listener questions, Manny. Just to finish off, I've got a quick lightning round. If you're ready.
Sure. I'm ready.
The timer starts now. Have you ever struggled with any sort of addiction?
I have not.
Cool. And what's your favorite food?
I would say tacos.
So you're not addicted to tacos?
I'm not addicted to tacos.
All right. Good. You're strong. I love that. If you could do something completely different with your life, if you'd never got into this area of expertise, what do you think you might have done?
Other than being a doctor, I would probably be a sailing instructor. I would love to be a sailing instructor. That'd be great, on the water.
I love that. That's so unique and different.
Yeah, on the water, yeah.
But in your job now, what do you love most about your job?
I would say the staff, they really get excited about coming to work every day and just making a difference in the lives of the individuals we take care of. So that excites me, and I love when a patient approaches me and says, hey, thanks for giving me a chance and thanks for helping me. That makes a huge boost to my month,
Yeah, that would be such a good feeling. What's the worst part? What do you hate about your job?
It's a chronic illness that we deal with, and there is relapse or lapse, and that's a struggle because I know that it just doesn't impact that one individual; it impacts an entire family system and community. So that's something we take seriously to really look at how do we support individuals throughout that process.
No, I can imagine. Yeah, it is such a tough thing to deal with. If you had a $1 million budget, what would you like to see? Where would you like to see that funding go?
I would go towards adolescent care or therapy and interventions for the adolescent population. A lot of the adults that we see, where they're at today is a direct product of something that happened when they were younger and they went years without addressing it. So if we could find ways to address issues immediately in a younger population, we could probably redirect a lot of individuals and really support them earlier.
Awesome. And what is your favorite method for helping people with addiction? What do you think is the most effective?
I think it's a combination. I couldn't lean on one, but I think introducing MAT or medication assisted treatment when it's appropriate, and then obviously having psychotherapy and clinical interventions. I think the combination of the two is excellent in ensuring that we address and work through and establish healthy coping skills, but also we allow individuals to truly receive the positive work by minimizing the cravings that they might be experiencing from the drugs. So I think the combination of the two work well together, and you can have one, or the other, but I think the two of them work very well.
Sounds about right. Fantastic. Well, thank you so much for answering those questions, Manny, and for everything you do at Ripple Ranch Recovery Center. I think this work is so important, helping people with mental health, with substance abuse, addiction, rehabilitation. Like you said, it is a chronic illness that affects so many people and their friends and loved ones around the world. I'm sure it affects just about everybody in some way or another. So what I'm trying to say is what you're doing is incredible work. And thank you so much for doing what you're doing and for coming on Traveling Science today.
Thank you so much, Jesse. It was a great honor to be on the show.
And just to finish off, considering everything we've discussed here today, if you had one final piece of advice that you'd like to share with our listeners, maybe something that they could take home and act on today to improve their lives in some way, what would your final piece of advice be?
Truly live in the moment, take every challenge one day at a time, and just understand that, negative things that happen in your life do not define who you are, and you can always make tomorrow a better day and make a difference.
So there you have it, legends. That was Manny Nsien, CEO of Ripple Ranch Recovery Center in Texas. And what a stand-up guy. You can really tell that he's so passionate about helping anybody and everybody who might have substance abuse or mental health issues, because it can have a huge effect, not just on the individuals themselves, but their friends, their family, and the community as a whole. And when people get help with their addiction problems, everybody around them benefits from it. And like Manny pointed out, mental health and addiction are not simply poor choices, they are chronic illnesses. Nobody is immune to it, and like any chronic illness, they require appropriate treatment, whether it's medication, therapy, or a combination of both, in order to help people reach that point of rehabilitation. And then also plenty of support to prevent recidivism. Word of the day, baby. So thanks again, Manny and Ripple Ranch Recovery Center. And if our conversation has piqued your interest at all, if you think this information could impact you in some way, feel free to check out the Ripple Ranch website for information and support. And that link is in the show notes just below. Also, make sure you're subscribed to this podcast for more Traveling Science every single week. Follow Traveling Science on Instagram to see who we're interviewing next and to send in your own listener questions. And finally, if you're more visually oriented, feel free to check out the Traveling Scientist YouTube channel. And if you stick around to the end of the episode, I always leave you with a little secret. And this week's secret is that I love trampolines. I grew up with a trampoline in my backyard, and I used to spend hours bouncing and bouncing on the trampoline. And recently, there's this trampoline gym or playground, whatever you want to call it. It's like a big warehouse just full of trampolines. And I was like, hell yes, let's go. So I went and bought an hour ticket and I started jumping and tried to do a few flips and I really hurt my back. Turns out I don't bounce like I used to. So now I'm just kind of limping around the house and feeling really sorry for myself. So that sucks. And I probably need to see a chiropractor now. I'm getting old. But anyway, that's all for today, legends. Thank you so much for listening, and I'll catch you all next Science Sunday. Cheers.